Are you suffering from knee pain at the age of 40? It's a common issue faced by many, and it can drastically impact the quality of your daily life. But don't despair. There are numerous ways to tackle this problem. From the ancient wisdom of Ayurveda to modern allopathic solutions, complemented by the power of exercise and physiotherapy, there is light at the end of the tunnel. So join us on this journey as we delve into ways to alleviate knee pain using Ayurveda, allopathy, exercise and physiotherapy. First, let's explore how Ayurveda can help in relieving knee pain. Rooted in the principles of balance and harmony, Ayurveda views knee pain as a disruption of the body's equilibrium. It aims to restore this balance, not just mask the symptoms. This ancient Indian medicine system uses a variety of herbs like ashwagandha and turmeric, renowned for their anti-inflammatory properties. They work internally to reduce inflammation and pain. But Ayurveda doesn't stop at herbs. It incorporates therapies such as Janubasti, a unique treatment where warm medicated oil is held over the knee joint. This helps to lubricate the joints, improving mobility and reducing discomfort. Ayurveda's strength lies in its holistic approach. It doesn't just treat the knee, it addresses the root cause of the issue, be it poor nutrition, lack of exercise, or even stress. By focusing on overall well-being, Ayurveda promotes long-term health and resilience. So Ayurveda offers a natural and holistic solution to knee pain, but let's not stop there. Now let's turn our attention to allopathic treatments for knee pain. Allopathy, or Western medicine, generally focuses on treating the symptoms of knee pain. Non-steroidal anti-inflammatory drugs, or NSAIDs, are commonly prescribed to reduce inflammation and pain. For more severe cases, doctors may recommend corticosteroid injections directly into the knee joint to bring down swelling and alleviate discomfort. However, these treatments are not without their drawbacks. NSAIDs can cause side effects like stomach upset or an increased risk of heart complications. Injections, while effective, are not a long-term solution, and repeated use can damage the joint further. Surgery, though it can help in severe cases, comes with its own risks and recovery time. Allopathy is often effective in providing immediate relief from knee pain. However, it's important to remember that it treats the symptoms, not the underlying cause. While allopathy provides immediate relief, it's also crucial to incorporate physical activities into your routine to address the root cause of the pain and prevent future incidents. Moving on, let's discuss how exercise and physiotherapy can help manage knee pain. Physical activity and physiotherapy are key components in maintaining joint health. When we move, we lubricate our joints, which can help reduce the discomfort associated with knee pain. In addition, physiotherapy techniques are designed to strengthen the muscles surrounding the knee, providing more support and reducing the strain on the joint itself. Now let's talk about specific exercises that can help. Leg lifts are a great place to start. By lying flat on your back and slowly lifting your leg, you're working the muscles around your knee without putting too much pressure on the joint. This exercise can be done daily, and as you get stronger, you can add ankle weights for additional resistance. Hamstring stretches are another beneficial exercise. They help maintain flexibility, which is crucial for overall knee health. To perform a hamstring stretch, sit on the edge of a chair with one foot flat on the ground and the other leg straight out in front of you. Slowly lean forward until you feel a gentle stretch along the back of your leg. Hold for 20 seconds, then switch legs. Physiotherapy techniques, such as massage and heat therapy, can also be helpful. These techniques increase blood flow to the area, promoting healing and reducing pain. So a combination of exercise and physiotherapy can do wonders for your knee health. To recap, knee pain at the age of 40 can be managed through various methods. We delved into the world of Ayurveda, which offers a holistic approach to health, aiming not just to treat knee pain, but to balance the body and mind. We explored the role of allopathy, which provides immediate relief from pain and inflammation, and can be a crucial ally in managing knee pain. We also emphasized the importance of exercise and physiotherapy. Regular physical activity can strengthen the muscles around the knee, improving stability and reducing the risk of further injury. Physiotherapy, on the other hand, can help maintain joint health and mobility, while also providing relief from pain. These methods are not mutually exclusive, but rather they complement each other. A well-rounded approach to managing knee pain often involves a combination of these methods, tailored to your specific needs. Remember, the best approach to managing knee pain is a combination of these methods tailored to your specific needs.